Hi, my name is Ashley Zabala. I am a part of the Barbaric Banshees along with Kyle, Brian, and Andre, and we are presenting HIV-AIDS in India. And why India? Well, it's because they have a collectivist community way of thinking, and basically in the mindset of an individual in this community would be, if I take this pill or if I take this protection, then I'm protecting my loved ones, I'm protecting my sexual partners, and I'm therefore protecting my community. Now, the religious decline in India has given sexual liberation to the youth, to the millennials, if you want to call us that. And this can be exemplified through the 150-year gay sex ban being lifted. And even though India has lowered its HIV rate ever since '08, it is still the third largest HIV population in the world. Now, India's at-risk communities. These are the LGBTQ communities, and this is through mainly unprotected sex. Sex workers are also 13 more times likely to get HIV, and this is also through unprotected sex. However, because that's their occupation, it gives them that higher chance of getting infected. And another at-risk community for a separate reason would be drug users, mainly through things like heroin that involves a syringe and a needle. And because HIV is transmitted through blood, they're basically injecting the needle and sometimes sharing it along with the syringe, which could contain infectious blood. Now, I'm going to turn it over to my colleague Brian, and he will pick it up from here.
Hi, I'm Brian Baez, and I'll be doing the early years of HIV and AIDS in India. So the first recorded incident of HIV and AIDS in India was in 1986 amongst female sex workers. By the following year, there were 135 cases reported. In 1992, the Indian government realized they had a full-on epidemic at their hands, so they created the National AIDS Control Organization, or NACO for short. In 1999, they changed NACO to the National AIDS Control Program, or NAPA 2. In 2007, they started targeting high-risk groups such as the LGBT community, drug users, and sex workers. They poured $2.5 billion into fixing this public health crisis. In 2009, they established the World of Work program, which was a law to prevent discrimination amongst HIV-positive people in the workplace. In the 2010s, HIV decreased by 0.28%. However, there were still small pockets of strong-strained HIV in India. So NACO decided to pour money into public health education to get the youth wised up on AIDS. I'm going to introduce my friend Andre. He will be taking over the rest of this project.
Hi, my name is Andre Nelson, and I'll be talking about HIV and AIDS. HIV is called a human immunodeficiency virus. HIV attacks and weakens the immune system. There are no known causes how HIV came to be. Earlier cases of the virus was found in the 50s. HIV weakens the immune system, which will cause AIDS over time. Acquired immunodeficiency syndrome. HIV-1, there are two types of HIV, HIV-1 and HIV-2. The main difference of the two types is HIV-1 is worldwide and all strains are active. HIV-2 is in Western African countries and only two are active. It spreads any type of unprotected sex, oral, anal, and vaginal, bodily fluids, of any affected person entering your body, blood, vaginal fluids, and semen, sharing needles and syringes with someone affected from HIV plus mother to child during birth. Symptoms, flu-like symptoms, fever, lethargy, chills, sweating, and swollen left and nose. Weight loss, diarrhea, and some are asymptomatic during the clinical latency stage of HIV, so that's why it's good to get regularly checked. Now I'm going to turn it to my next colleague.
Thank you, sir.
Mm-hmm.
Hi, I'm Kyle Sadman, and today we're going to be talking about medications for HIV and AIDS. We're going to start with prevention. Now, pre-exposure prophylactics, or PrEP, are pills taken daily to help fight the oncoming of HIV in sexually active people in at-risk communities. PrEPs, when used with condoms, greatly reduce someone's risk of catching HIV when sexually active. Now, the most popular PrEP came out in 2012 and is Truvada. Truvada contains two main parts, amitriptyline and tenofovir. These combined help build up a wall against someone who does not have HIV, so it helps prevent it. HIV treatment involves taking medications daily to help slow down the process of HIV in someone's body. HIV will break down someone's immune system, opening them up for all sorts of diseases, including AIDS. So it's very important to take these medications daily, and it's very important to keep HIV in mind when you're in at-risk situations. HIV is a type of drug called a retrovirus, and the medicines used to fight this drug are called antiretrovirals. There's a new therapy going on called antiretroviral therapy that combines all these antiretrovirals into one process. This medication, antiretroviral therapy, which came out in the 1990s, has saved many lives. It is because of these new developments that HIV and AIDS have had many less deaths in recent years. Now we're going to show you a quick clip from a popular show, Shameless, which shows how quickly HIV and AIDS can spread. Thank you.
Good afternoon. Thank you all for coming in on such short notice. Earlier today, I was contacted by the county health department.
Lice again?
Oh, I wish.
Then what? I got an open house in 30 minutes.
There's an epidemic at our school. Measles?
It's because of those anti-vaxxer French kids you let in, isn't it?
It's not the measles. We're talking about a very delicate issue. A sexual epidemic.
In elementary school?
That's the French.
My kid's 9.
And she's a giant slut.
Honey, stop.
I'm serious. You should see what her daughter wears out of the house.
It's called style. Maybe your son should take a few pointers.
Please, enough. I'm not talking about the children, for God's sakes. I'm talking about you people. The epidemic has been traced to this PTA. I'll turn this over to Dr. Jonathan Rosenbaum from the County Health Board to further explain.
Thank you. As mentioned, this is a sensitive issue, but one that we do not take lightly. Over the past few weeks, 4 people have tested positive for virulent strains of multiple STDs. The only thing these people had in common was this PTA group. In all my time at the county health department, I've never seen symptoms of all 3 venereal diseases, chlamydia, gonorrhea, syphilis, in 4 people at once.
Who the hell are the 4?
Yeah, who is
Me.
it?
Bullshit.
I can't reveal that information, but swift action must be taken so we can learn who these individuals came in contact with so we can contain the epidemic.
You're saying these 4 people may have given it to the rest of us?
Yes.
But that could only happen from sex.
You don't get an STD from a toilet seat.
This is absurd. If you excuse me, I have a root canal to perform.
Sir, you're gonna stay and be tested.
Can't keep us here against our will.
Actually, I can. The Illinois Sexual Transmissible Disease Control Act states that we can order the testing and the isolation of an individual to stop the spread of an STD until such time that the danger to the public health is eliminated. That's the law.
What?
Are you kidding
Okay,
me?
ladies and gentlemen, as soon as everyone is tested, we can determine who can leave and who will need intravenous antibiotics. Thank you.
Where's Barbaric Banshees?
This was HIV/AIDS in India.
We appreciate you tuning in.
Thank you.